My name is Ashley Perkins, and I am doing my case study on the Baker's cyst. A Baker's cyst is a fluid-filled cyst in the popliteal region, or the posterior knee, with a chief complaint of tightness in the knee. It also can have redness or swelling, and usually you can see a bulging appearance on the outside of the knee, like in that picture I've included. In the picture, I've also included the synovial fluid and what it kind of looks like with that bulging appearance when the synovial fluid leaks out. Synovial fluid is located within the capsule that surrounds the knee, and that allows for smooth motion without friction between the bones. So common etiology is osteoarthritis, rheumatoid arthritis, torn cartilage, or trauma or injury. All those things kind of predispose you to getting a Baker's cyst. They also have, all of those conditions cause the need to produce excessive synovial fluid in that popliteal bursa. So this picture kind of also shows that really well. So a Baker's cyst can also rupture, which causes severe pain, and people have noted like they can feel fluid running down the leg. So the incidence for a Baker's cyst is 5% of the entire adult population. However, it jumps up to 33% in patients with rheumatoid arthritis. It's most common in females, mostly because rheumatoid arthritis is most common in females. So signs and symptoms we kind of went over a little bit, but the fluid-filled lump, pain, stiffness, like a lot of people also note like a lack of like range of motion or the ability to bend your knee, and of course swelling. And that picture I love. I think it shows the Baker's cyst really, really well and defined, which is really cool to see. So the diagnosis, treatment, and prognosis of a Baker's cyst. Ultrasound is the preferred imaging diagnosis. You can also see it with like MRI, things like that. But with ultrasound, it's just the most common one to do because it's less expensive and it's commonly seen. Non-surgical treatment that you can do with the Baker's cyst would be rest, physical therapy, anti-inflammatory medication. Also a common one would be steroid injections. As far as recovery goes with that and like feeling better, it can just kind of depend on what you're doing as far as those options, but it usually takes days to a couple weeks for recovery. That steroid injection I think honestly takes days, but physical therapy definitely a couple weeks. If you choose to go with the surgical treatment route, they'll probably most commonly do the cyst drainage. They could also do an arthroscopic knee surgery if you're having other problems with your knee or you've just had a history of that. They might have you consider doing that. As far as recovery with that, everyone's different, but commonly like the 1 to 3 months of recovery. An important thing to note is left without treatment of a Baker's cyst, there is a risk of increased pain or the rupture of the cyst, which would be extremely painful. So it's good to get it checked out. So this is my case study I chose to do. Unfortunately, I didn't see any Baker's cyst in my clinic site. We did do an ultrasound for one, but we didn't find one. So I just kind of created my own little case study here. So a 52-year-old female presents to the emergency department with a chief complaint of right knee pain with a bulge and swelling and redness in both of the legs. So her onset of symptoms, she has swelling and redness on both legs that's been present on and off again for about 3 months. On the right posterior knee, she has had increasing pain present for the past 5 days, and the patient can agree that her onset of pain began when she took up hiking again with her husband, and she has noticed that the pain begins to flare up after she goes on those hikes and exercises. So they decided to do some lab work on her, the rheumatoid factor, as well as the elevated erythrocyte sedimentation rate to look more into the possibility of having rheumatoid arthritis, as she is a female at her age, and as well as the flare-ups. The doctor assumed that that would be something to take a look at. He also ordered an ultrasound of the right posterior knee to rule out a Baker's cyst, as he is able to see that bulge on the right posterior knee, and assumes that she probably has had a history of rheumatoid arthritis, but it hasn't been diagnosed yet. If the ultrasound comes back not finding anything, the plan was to order a follow-up MRI to see if the MRI could see anything else. All right, so the diagnosis, the labs did come back positive for rheumatoid arthritis, which is kind of what the doctor assumed. The ultrasound also indicated a Baker cyst in the right knee. So this image is really awesome, shows it pretty clearly. It's a very thick-walled, echogenic little ball right there surrounding the synovial fluid right there. So treatment and prognosis, there is actually something called ultrasound-guided aspiration, which is done to drain the cyst. If anybody's done like FNAs at their clinical site, it's pretty similar to that. Pretty much you have a doctor come in and drain the cyst through ultrasound guidance. Pretty much the patient will just lie prone on the bed, the doctor will provide a local anesthetic, and then we'll use the ultrasound probe to guide the needle into the cyst for draining. Usually a pretty quick procedure. I think I've looked into it. It's about 30 minutes to max an hour depending on the situation. Fairly quick though, and painless as far as the local anesthetic goes. We've also looked into the success rate of that. Patients have said that it's been very successful for them and they have reported little to no pain, which is also the same thing that happened with this patient. She was also prescribed DMARD, which is disease-modifying anti-rheumatic drugs, which helps with rheumatoid arthritis. And the doctor also thought that would be smart, as it can hopefully decrease the likelihood of her developing another cyst, since she has now rheumatoid arthritis. So a differential diagnosis could be a couple different things. Popliteal vein thrombosis, deep vein thrombosis, same thing. A hematoma, a tumor, or a popliteal aneurysm. All those things could be different things that we could have diagnosed. The number one thing that would have been as concern would have been the popliteal vein thrombosis. With redness and swelling, that could have been something that they also would have wanted to check out for deep vein thrombosis, ruling that out as those symptoms are the same. The cyst also could have ruptured, causing that redness and swelling. So you don't know until you order a test. So that could have been something that would have also been a diagnosis. In the image I've kind of shown, it is common to get blood clots behind the knee. They do call them the popliteal vein thrombosis. And here's an ultrasound picture I've included of what that kind of looks like. So just definitely checking out using ultrasound to be able to determine the diagnosis. And then these are my 3 peer-reviewed references and then my image references.